Okay, good afternoon. We have convened this group today to discuss merger and acquisition opportunities between one of two failing rural health organizations. As the CFO of this organization, I'm here to objectively present the findings from the research conducted over the last few weeks. I've researched Putnam County Rural Health Clinic Incorporated, located in Baxter, Tennessee, and Central Kansas Medical Clinic in Great Bend, Kansas. University of New Mexico Hospital. We have outlined a clear mission, vision, and core value statement on our website. Here at UNM Health Systems, we know patient care, patient education, and research are all key to a successful future for our organization. When researching for a rural system with which to merge, we should look for an organization with a similar mission and vision. That organization should provide accessible, high-quality care for the people in their respective communities. So let's start with Putnam County Rural Health Clinic. In the beginning, I created an organizational snapshot. It outlined a few details about each healthcare facility. Putnam County Rural Health Clinic is in a city of a population of about 1,300 people. Per 2014 census data. It's a nonprofit organization filing under 501c3 status with the federal government. The mission and vision of Putnam County Rural Health Clinic has two parts. One is to provide accessible, affordable health care to the rural community in which they serve, regardless of the ability to pay. Two, to provide health service education to the population to lead them to make better choices for their health. The history of the clinic began well before 1999, but the current clinic was incorporated in this year. Many of the surrounding clinics had closed over the years, but Dr. Kenna Williams saw the need for the clinic. Dr. Williams and other community leaders reopened Putnam County Rural Health Clinic. Central Kansas Medical Center is located in Great Bend, Kansas. The city has a population near 16,000 in 2014 and offers many attractions for citizens and tourists. The hospital is also a 501c3 organization. It is listed on their tax returns of an even larger health organization called Catholic Health Initiatives. It was difficult to find a clearly defined mission and vision statement for the facility. Their website simply states it is committed to serving the needs of the community. However, if we were to search the website of Catholic Health Initiatives, a massive corporation operating out of Denver, Colorado, they have a very clear mission statement. The health system is faith-based, and as such their mission is to nurture the healing ministry of the church, supported by education and research. The vision of the corporation is to lead the transformation of healthcare to achieve optimal health and well-being for individuals and communities they serve, especially those who are poor and vulnerable. The history of Central Kansas Medical Center begins in April 1903 when the first patient was admitted to this hospital. Community leaders asked the Dominican sisters, or nuns, to start a hospital in their great city, and they did so in a former dormitory. The hospital grew rapidly, and it began offering other services, including a program to train nurses. So why a rural health clinic? Because rural health clinics are struggling financially. In the cases of these two facilities, they are both in states that chose not to expand Medicaid, Kansas and Tennessee. The states are choosing not to accept at least $5.3 billion and $22.5 billion respectively from the federal government, money that is needed to fund these rural facilities. Rural hospitals often depend on Medicare and Medicaid dollars because of the populations they serve, elderly and the low income. To stay open, some are choosing to partner with larger healthcare organizations. The benefits to the rural facility include better purchasing power, access to electronic health records and more robust IT departments, capital improvements like building improvements, and debt assumption. The larger or the acquiring hospital can increase market share, control costs in the community, and most importantly, create accountable care organizations. ACOs under the Affordable Care Act are a strategy to encourage collaboration among providers to reduce costs, increase efficiency, and improve care coordination for the patient. The partnership keeps rural facilities from reducing services or closing in the communities where they are so desperately needed. So how did we analyze the facilities? We used 3 things. The first thing we created was a merger heuristic. In it, we compared each facility based on 10 criteria, some of which include expenditures, financial stability, governance, and geographic locations are just a few criteria compared. Secondly, we created a financial report. We compared the 2 institutions based on capital expenditures, long-term debt, operating margins, and salaries and wages. Lastly, we created a credit worthiness report. This long word tells investors and other stakeholders how likely a healthcare organization is to pay its debts. To determine a hospital's credit worthiness, one will look at its market position, operating performance, balance sheet, and debt structure. So what did we find on the heuristic? We compared the organizations side by side based on those criteria. We looked at technology, anti-competitiveness, work with stakeholders, and geographic locations. For Putnam County Rural Health Clinic, their technology is almost non-existent. Meanwhile, Central Kansas Medical Center has a well-rounded website and patient portal. Putnam County Rural Health Clinic does not appear to create any competition for UNM, where the larger health facility at Central Kansas Medical may create some competition with UNM. Work with stakeholders at Putnam County Rural Health Clinic. There was some in the beginning to help create the clinic, but no other evidence since. Meanwhile, Central Kansas Medical Center, their work with stakeholders is evident on their website. Geographic location. Baxter, Tennessee is a small rural town, but is likely to have untrained labor pool. This clinic may benefit from a merger. But with Central Kansas Medical Center, geographic location, the city is larger and likely have a more trained labor pool. Then we moved on to the financial report. It tells the story of the healthcare organization. Financial statements will include the balance sheet, the statement of operation, statement of changes in unrestricted net assets, and statement of cash flows. For this report, I looked at a few lines on the balance sheet. The balance sheet is usually first in the financial report as it provides a quick snapshot of organization's finances. On the balance sheet, we will find capital expenditure described as fixed assets. Fixed assets can depreciate as they are subject to wear and tear from use. The reduction in value is listed as a non-cash expense and has a tax advantage for each organization. Long-term debt is defined as debt that will not be due for over 12 months. This debt from long-term loans or other purchases must be disclosed on the statement of cash flow. It demonstrates the flow of cash during the fiscal year. Statement of revenue will be found on the statement of operations. It shows the profit remaining after expenses are paid. Revenues from all patient activity are listed in the beginning of the statement, and then adjustments are made from charity care and contractual agreements. Looking at our 2 facilities, capital expenditures are significantly less for Putnam County Rural Health Clinic compared to Central Kansas Medical Center. Long-term debt is also less, with Central Kansas Medical Center having over $66 million in long-term debt. Statement of revenue for Putnam County Rural Health Clinic is just $353,000 compared to over $20 million for Central Kansas Medical. Moving on to credit worthiness. When thinking about credit worthiness, think of it as an organization's credit report. How are they managing their revenue and debts? There are 3 companies who determine the credit worthiness of other organizations. It's Moody's Investor Services, Standard & Poor's, and Fitch Ratings. Each uses about 5 key factors to grade a healthcare system's credit worthiness. things like market share or position, operating performance, balance sheet and capital plan, governance and management, and debt structure and legal governance. More specifically, we looked at market share and governance and management for the two rural organizations. Market share looks at the percentage of total volume of sales captured by a business in an area. A hospital with a large market share would have numerous facilities and offer services that no other facility has. Their name would be recognizable by those in the community and synonymous with high-quality care. In researching Putnam County Rural Health Clinic, it was difficult to determine if they had more market share than another facility. While the facility boasts a 45% increase in patient count, the small clinic is not mentioned on the county website, nor does it have a functioning website of its own. Meanwhile, Central Kansas Medical Center has a vast market share. They offer a range of services and educational classes for its patients. Governance and management are important to creditworthiness as well, because the board are the ultimate decision makers. The members set the vision and direction for the organization. An ideal board of directors will be diverse and have a stake in the company. Putnam County Rural Health Clinic is a small clinic with an equally small board of 10 members. This small board has been able to make some tough decisions to keep the clinic open and have created strategies and initiatives for the future. Central Kansas Medical Center is a large facility with 18 members on the board. The Dominican sisters still maintain a seat on the board to ensure the direction of the facility remains faith-based. However, it's difficult to determine from the IRS Form 990 what positions some board members hold. This board, though, has created a clear mission and vision for the future of the organization. So, some suggestions for improvement post-merger. Putnam County Rural Health Clinic needs to increase their internet and social media presence. No one knows who they are. It's not even on their county website. They also need to increase fundraising. Central Kansas Medical Center, however, will be acquired from Catholic Health Initiatives, so there should be a reduction in salary and wages as some positions are combined or eliminated, and they should also seek further debt reduction strategies. In conclusion, Putnam County Rural Health Clinic has non-existent technology. They wouldn't present any competition for UNM, but their work with stakeholders is unknown. The cost of running the clinic is significantly less, but they also have an unknown market share and a small board. Central Kansas Medical Center has a robust technology patient portal. They're highly competitive, though. They might compete with some of the services that we offer. However, their work with stakeholders is evident. The cost to run the clinic is extremely high, though. They do enjoy a high market share. In their large board, they do have a large board of directors, but likely that will reduce with a merger or acquisition. So I presented everything to you. If you have any questions, feel free to ask now. Thank you for your time this afternoon. Bye-bye.